The vision of the Bethesda Foundation is to promote and support the mission of Bethesda Hospital, Bethesda Butler County Hospital, Hospice of Cincinnati, and Fernside Center for Grieving Children. We recognize that philanthropic support and donor contributions help create the margin of excellence in these organizations and allow them to be leaders in the local healthcare community. That vision, that opportunity is very powerful for me, for my staff, for those who engage with us. The opportunity to change lives, to save lives through our work, to see it come into reality through those organizations is highly motivational for us.
Well, this day and age, it empowers me a lot because healthcare is going through a tremendous amount of changes because of the Affordable Care Act. So we believe that over the next 3 to 5 years, there's going to be a lot of consolidation within our industry. However, the payers of our services in the future are going to demand quality outcomes and providers that can deliver that and prove their case. And we think we've got the services to be at a good position in the future. So we think not only will the industry consolidate, we think the payers are going to push more seniors to get in-home care service. So we think 3 to 5 years from now, our industry could have half the amount of competition, but twice the number of patients. So that's pretty empowering when you think about the challenges and the opportunities that are ahead of us.
So I have the bounty of working with health innovators every single day. And I can't imagine that there's anything more empowering than helping people bring their ideas to life. And those ideas have the potential to impact the health of individuals, families, and people all around the world. So the work that I get to do every day is in itself incredibly empowering.
So my colleagues at University of Cincinnati are incredible. They're some of the best and brightest surgeons in their different fields. It's incredible to be a part of a giant group. So there's trauma surgeons and urology surgeons and cardiac surgeons and pulmonary surgeons. And nowadays, patients get sick in incredibly complex ways. So it's amazing to have access to their knowledge and experience.
My colleagues mean in my organization everything, particularly because Buckeye Home Health Care here in the Cincinnati market is new. We've been in Dayton since 2006, but we're fairly new to the Cincinnati market. So we, as a team, are incorporating a lot of different roles. So we have to depend so much on each other.
Your colleagues are your team. And when you are treating really sick patients, when you are working with families who are in crisis situations, when you are trying to make discoveries that are going to help drive the way care is delivered in the future, that team is critical.
They mean a tremendous amount because we started the company with 2.5 employees and have over 1,400 today, and I can't do anything by myself. I can talk about the vision and get people excited about where we want to go, but it takes a team to get it done. So we've got a great group of people that have been with us a number of years. We continue to add other positions that are strategic for whatever geographic market we may need or a service that we're going to get into. And it's fun having a company that's grown as much as we have over recent years because people know about us and they want to come to work for us. So it's exciting when you have a culture that attracts good talent.
I think some of the best advice I ever got as a leader was way before I was ever thought I would be a leader, and that was really listen to people, pay attention to people who know more than you do, learn from them, and also to look at outcomes, look at what really brings change, not just the theory, because there are a lot of theories that really don't work. So you have to examine, do real good research and say, does this work? If it doesn't work, stop it. If it does work, do more of it.
So the work that we do is innovation. So Viable Synergy is dedicated to creating new products and services that improve the lives of patients and make healthcare less expensive. And so everything that we do is about innovation. We identify the innovators who are courageous enough to work to improve health and to reduce the cost of healthcare, and then we provide them with the support that they need to actually achieve that.
As we look at the whole person, so we take more of a holistic approach. We're looking more at a psychosocial approach. So we're involving social workers. I myself am a social worker, so it's a huge, important need to me. We're looking at folks, so we're involving their caregivers, we're looking at community resources. We're not just looking at their physical needs, we're also looking at going a little deeper. What else do they need emotionally?
I think one of the things that makes UC Health special is that we're also, again, thinking about research and discoveries and not just following the established standards of care, but also thinking about how do we incorporate new discoveries, new innovations, so we're actually taking better care of patients. And there are a lot of examples in UC Health's history where we have been able to do that, and it's really an honor to be at a place that has such a proud history of discovery and innovation.
It's great to be a part of UC where they're looking at quality, they're looking at excellence, they're looking at cost, and taking advantage of this bench to bedside where we apply what we learn from research to patients that we're taking care of now. And that's a very dynamic process, and it's a very active process, and it's constantly changing, and it's very exciting to be a part of that system.
Probably if I were not in healthcare, I would find something like flying or X-ray vision, but I would say the power to heal. In healthcare, it is about healing, saving lives, changing lives, and our caregivers, our physicians do amazing work. I have the ability to heal and help those individuals in their mission and their work. I think that would be incredibly rewarding.
The superpower, oh my goodness, what if I had a superpower? I think it would be the ability to speak to people in a whole lot of different cultures. My organizations are in about 100 countries, and I'd love to be able to speak to those people all over the world at the same time and really be in touch with them and hear what they have to say. That's what I'd love to do.